có lu suốt đào ô đâu lăng thia lu sẽ sinh yêu những xa trở có ca sáng mùa có nhai có của nhau cô chỉ ở không xin dài không giờ chỉ một tu đã cho tôi theo cùng mong cô chỉ ở xin lo tồn tại rong gạo chỉ một lần tới nhà cho cô lúc bé cô chỉ ở con nụ cô nhỏ sống cô họ có giờ cái lối có bù bù lúc cô nhỏ nung lại ra.
Very nice, very nice. What's up, everybody? We got a great show today. We got a doctor on the show. The doctor on the show. So I never had a doctor on my show, so this is gonna be cool. So yeah, so look at learn a little about chiropractor and acupuncture and all that good stuff. I never believe in it, until my aunt actually did acupuncture on myself. I had a cough and she did acupuncture on me, and then I didn't cough for a week. So I'm like, no, that can't be right. And then that kind of stuff. I'm like, holy cow, I believe it now. So if you guys ever had acupuncture or ever done a chiropractor, give us a thumbs up. I'd like to see any feedback here, or just say hi where you guys are at. I think we got our guest coming from Minnesota. So let me confirm it. See what town she's in. But yeah. So guys, if you guys seeing this, just give us a welcome. Let us know where you guys are seeing this from too. All right. So with that, let me just bring her on the show. Let me hide this screen here and bring her on the show. I think it's 3, 2, 1. Hey, what's up, Najong?
Hello, Yajong.
Hey, so to clarify, Colombe, right, is Dr. Yer, right?
Oh, Dr. Yer.
Dr. Yer. All right, great. What town? What town? Is it Minnesota, St. Paul, Minneapolis?
Hulu clinic nhớ Crystal, Minnesota now. Crystal, Minnesota. Yeah.
Okay. Crystal, Minnesota. It's Kanyo, like where? Like in
Kunyo Dayton, Minnesota.
Okay. So yeah, you guys are close by, just give us a holler. We got Chris from North Carolina. Hey Chris. Go see says, hey, hi from Minnesota. And Linda goes, hey, congrats to all your accomplishments. So Linda, I don't know. So that's very cool. So guys, let's start. Welcome to show Hmong Hustlers, show 68. So business, right?
Sure.
Yeah. So chiropractor and acupuncture, right? How did you get started in this?
Well, it's like you just have a dream, in high school of what you want to be when you're older. So I had a dream about being a doctor, but there are all kinds of doctors out there. So but I wanted to be a healing doctor, like a medical healthcare doctor. No? Yeah. So my first thought was I wanted to be an eye doctor. Then I changed my mind and I just went into chiropractic because there was a chiropractic school in town, in Bloomington, Minnesota.
Oh, okay. So, right? Is that how it is, or like, is it easy, or I don't know. Is it? What does it involve? Is like, is there you gotta go to college for that, or like a trace, or how does that work?
It is a professional career, so you want to do at least 3 years of undergrad in the health sciences field, kind of like prerequisite to medical clinic, medical school, or any kind of doctor, eye doctor, medical
Uh-huh.
doctor, you want to do 3 years of undergrad and then apply to the professional school, or you can finish your BABS in like biology or psychology or chemistry. You
Yeah.
apply to the professional school and you go for like 10 semester, so it's almost 4 years of professional school. Huh?
Wow. So it's got a 3 year undergrad, I got another 4 year on top of 100 there.
Yes.
Wow. So and then 100 is that just for new? Is it chiropractic acupuncture? Okay, or is it like new separate? Not.
It's together. Yeah,
Oh, okay.
acupuncture on the side. Okay, if you're in the chiropractic program,
Uh,
the acupuncture program is only 1 year. Thì có chi nhớ hậu chiropractic program á, có một cái acupuncture so it's like a master's degree, which is 4 years.
wow. So acupuncture longer, right? And then chiropractic just 1 year, right?
Yeah, if you are in the chiropractic program,
Uh,
then the acupuncture program will just be 1 year because the courses in chiropractic overlap with the acupuncture courses now. So
oh, okay.
you're killing two birds with one stone. So if you're in the chiropractic program, then you can do the acupuncture program within 1 year. However, if you just want to do acupuncture, then you have to go for 4 years.
Oh, okay. Gotcha. Okay, Yama. Oh, wow. Okay. So what's harder? The harder is 很有效解药好 what chiropractor or acupuncture?
Um, so yeah, I think acupuncture 4 years is harder because you
Uh,
have to memorize all the meridians in the human body, you know? And
uh.
each meridian has like a ton of points. Like let's say the stomach meridian, it has like 60 points in the body that you have to memorize.
Oh my god. Okay, Sky, each point yeah is where 更高 to go.
Oh yeah, and yeah. So meridians are like your energy line. They're invisible. They're just energy within your body, and
Uh,
they're called chi or meridian. Huh? And
uh,
they Chinese they name it they name it they give it the internal organ names, no? So like
yeah.
you call it stomach meridian, heart meridian, kidneys, livers,
Hmm.
gallbladder, bladder
So
meridians, no?
so the stomach has 60 meridian
No,
itself.
60 points.
Oh, 60. Oh, oh, okay. The point is that your point you can go right. Okay, what's a
Yeah,
meridian? Meridian is that the area?
no. Meridian is the line, uh, uh, is the invisible energy line within the human body now.
Oh,
Um,
okay.
yeah, nếu ý cho so phái phá hả?
Yeah.
You cannot dissect it, but it's just energy line in the human body. Yeah,
Uh,
so we call it like the stomach meridian. We call it the heart meridian, and so they're just lines, and in each line there are many points now that you have to memorize. Some points are stronger than others,
uh.
so yeah, we don't like needle every point, but we focus on the major point that affect the body the most. You know?
Wow. Okay, so like the whole body, how many points is in the whole body?
400 plus
Oh,
points.
holy cow! Like over is it over or just like about 400? Yeah, something like that, right?
Yeah. Mhm.
Yeah. Like what's the one that hurts the most? I think the one that hurts the most, kudung mango icho like is like my the your my chin, right? Is that
No, no, this doesn't hurt. It's the bottom of your feet.
Yeah, that too. Oh my god, multi-telio.
It's the bottom of your feet.
Why is that? I don't know. Like, why is that? Like, got okay, you know, right? It doesn't really that hurt, but why is it the feet? Is it more nerve down home? What is that? What is where?
uh, no, no, nó bị chính câu your nerves are bingo your muscle na bingo your
Uh,
muscle and the ligaments and
oh,
the bottom of your feet is very thick
uh.
with ligaments na.
Oh, so you guys, I don't know anything about this. So, so you guys got any questions? Ask on the show, and maybe she can help you out. If you got any sort of illness or something, though, maybe she can help you out as far as what she can do for you guys. But I don't know anything. Good just out there. Hey, don't mind nói bằng câu mình chỉ sẽ so, yeah. So, that's okay. I guess that's right. You go, yeah, my feet mostly good. Your feet hurt. They good to end long. Go they go like, oh my god, what the but when that got pointed, how change is this where it hurt too, or
There's a meridian point right here.
huh,
Yeah, name will put you right here, man. Yeah, this is
huh,
a important point too. It's for like Bell's palsy, facial issue na.
huh.
Like Bell's palsy day you your nerve no chimojo na no weak and it makes go na, like
Oh yeah.
your
Okay,
eyes
yeah.
small and your mouth weak so you drool.
Did what does it do? Does it relax your muscle or what is it?
Yes. Yeah, no, relax your muscle and let go. Let the nerve, dipana, go
Uh,
your muscle. Let go of the nerve. Because you pinch the nerve, the nerve really function, so the nerve, there's only your water hose, like the water hose that you hold your grass outside. If
yeah.
if it gets compressed, then it's weak and then it's not energy function, not energy function.
Oh,
Energy function thì là dùng li trong vừa để có một chủ để làm em mấy xin hả thì
yeah.
yeah thì giờ thôi có giờ nerve có giờ muscle muốn được pinch lại thì nó chúng nó rồi thì có lúc chúng nó gì xin hả có lúc ai gì.
Oh, okay. Gotcha. Gotcha. Okay. So, so within how business, like how many years? How practice know that?
22 years in practice.
Years. Wow, 22 years. And then like what's the most thing like ask for service? Is it the chiropractor or the acupuncture part?
Chiropractic, the profession of chiropractic is new to Bay Hmong community now. We just come to know in the last 20 years, when when a few of us became a chiropractor. So it's a newer career and newer way of help people now. So you bên muốn chỉ cho both chiropractic service cái no là both acupuncture door because acupuncture originated in China and it's been practiced for hundreds and thousands of years.
Yeah.
Chiropractic is a newer profession that occurred in the U.S. now. So bây giờ muốn nhìn nhận có cũng chưa. Yeah, they love acupuncture. And chiropractic, really, chiropractic services is similar to like your parents. When you sprain your ankle or when you sprain your elbow, and your parents try to pull it so it align together now, and when it's out of place, na. Yeah, so chiropractic service is very similar to what our parents back in Laos practice, but we don't name it. We don't have a name for it, but our parents and our grandparents and our great parents that they know that because they're just up in the mountain and they don't have any medical doctor around. They have to know practice pulling your joint when it's out of place. So that's what chiropractors do when you have a sprain or a strain in your elbow or your
Uh,
shoulder or your ankle or your neck. Now we crack it or we adjust it so it align again. It comes together naturally. Not new the non joint together naturally. Got no jito to ta or no jito go out of alignment.
so that's okay. So kind of so you sprain you call ankle nut. It's not because she chiropractor was it right or because she acupuncture go. How what do you use?
I
Because
don't
like go I run a lot right. Go in your kiana. Just you could tell sometimes not the sprain ankle. How do you fix that? Can fix it that.
know. Yeah, I do both. You know, you pull on the ankle joint.
Uh,
Gonna just lay na. You know, like gonna just
yeah.
you pull it so no in place, and then
Mm-hmm.
we do acupuncture on it to release the pressure, the pain, and
Yeah.
then it'll heal faster. So we could do acupuncture on the sprained ankle, or we could do like uh, therapeutic ultrasound, look
Uh,
ultrasound machine, or we could do electrical muscle stim on it for the muscles and the ligament. So we have to do both. We have to work on the joint so they just all go out of place, and then
mm,
we have to work on the muscles and the ligament so it's so it doesn't swell up, or
yeah.
it's not inflamed. Yeah.
That's very cool. Okay, next time. And you got one. How long does it heal? Because usually you more ice just it, you thought within there, right? Nhưng mà heal na. You got on the how long does it process heal na? Do you know?
Um,
Is it
yeah,
faster?
then you heal faster. No? If you treat yourself at home, you go
Uh,
for ankle and just up spring alone. It go
uh,
on and wiggle, wiggle. Like come on and stretch and wiggle, wiggle, and then that align. Then
uh,
it'll heal. Then it will heal. It'll heal really fast. But
mm-hmm.
there's you go on major sprain like your joint are like way out there. And
Yeah.
if you don't pull it, gonna yeah, it's gonna take months. It needs a little pulling if it's like misaligned really bad, like my two fists
Yeah.
here. Yeah, misaligned a lot, you really have to work on the joint so that come on pull gonna like okay, no, no. then
Yeah.
it'll then it will heal. But you could keep pulling it and it's stuck, then you're
Yeah.
gonna be hurting for months. Yeah.
So you have to like do the chiropractic part that you come on Mongo and relax the muscle so it can heal faster. What about
Yeah.
you got bullet? Sometimes you bullet how how is that? Yeah, you want is it better? Because usually like that you can't fix got you to toss like you to stretch, right? How would you fix that? Is it the same thing?
Yeah, so you lay it down, it's called torticollis. You lay
Uh,
it down there, you can, again, your neck joints, no, no misaligned, no
yeah.
misaligned. So it's really painful. If you come to the clinic, then we gently stretch it and we gently adjust it.
Uh-huh.
If you don't come for treatment and you have to do it yourself, like, yeah, you have to stretch it, and
Uh-huh.
plug and massage, massage
Yeah.
the muscles and the ligament. And after a week, it'll heal. Yeah. But if you come to the chiropractor, they'll work on it better and faster now.
So you cut you from a week to maybe like a couple day? Yeah.
Yeah. Uh-huh.
Wow. Because that, yeah, mostly good like it's like over even tea, like you should know the Advil, right? Actually, you did in hormone. I'm like, oh man, you could just not to chua then, so yeah, I get what you're saying. So so that's a better place just to go chiropractor and then that fix it. That's great. There's a few questions like do you use your hand tools or laser as a chiropractor or do you work on athletes?
Oh, yeah. So when we use our hand, it's called manual adjustment. No, no, okay.
Uh-huh.
Um, we also have some other instrument, and they're called activator, which is
Yeah.
like a gun. It's the shape of a gun, and it clicks. It clicks really fast. So
Yeah.
it's very gentle on the patient because
Yeah.
no high velocity and low amplitude. So bên click click cái nữ什么炸呢个不差的，那个打那种狗那种多呢，那炸的是 you don't feel the pressure from hand adjusting. No, okay, when
Uh,
we hand adjust, then we have to have you breathe in and out, so you
uh,
relax and you can feel our pressure. But when we use the metal gun and it's called activator or
yeah.
it's called there's another one that's it's kind of like a jackhammer, you know. It's like no no,
Nindao, Nindao, so yeah.
yeah no no the Tena. So I think I forgot the name of it, but there are two instruments besides using hand to move the joint in your body, you know, okay?
Uh, okay, cool. So, all right. So, do you work at Outleys? I mean, it doesn't matter, but Outleys, right? You're a lot of thought, you know, you're just gonna work on them, right? I guess, you know.
So like we see patients from infant to 121 years old now. So for infant, because their bone are really small, so we just use our little fingers, and not we don't use the whole hand. We use the
Uh-huh.
fingers to adjust their little bones. For geriatrics or
Mhm.
a senior patient, because sometimes their bones are osteoporotic, they're thin and they fracture easily. Then we tend to use activator, so the metal gun.
Oh, gotcha.
Yeah.
Okay.
Họ cho
Um,
in the họ cho a 5 to 50. We use our hand to really move the bones. Unless they don't like it and they want the metal gun called
okay.
activator. Huh? Yeah.
Okay, cool. Yeah, I don't know any of this, so that's so. You guys have questions? Ask them on the show. So, Anthony, do you fix Bell palsy? That's very easy, right? That's a you know fix the Bell palsy. I mean, I guess call on it. Like, how long does it last? I mean, how long does it take to fix how Bell's palsy?
Okay, so yeah, they both does positive. Yeah, thôi, nè ít sao? Chứ không gì, nè không một cái chỉ lại, nè nó còn do gì rồi nè, because nè sao nó chỉ một rồi nè, your nerves get pinched, um, from your neck. So what we do is we adjust the neck, and then we put in a bunch of acupuncture needle on the side that is weak, and also like we massage it. We massage the back of the head and the neck and the face to relax the muscle now, because the reason you have Bell's palsy or your face is crooked is because the nerves that come from the back of your ear, trigeminal nerve, na back of the ear, and stimulate your whole side here. It got pinched, so we have to work on that side, and it takes like usually 10 sessions. Then don't go to 10 times, get
Yeah.
adjusted 10 times, get massage 10 times.
So it's like 10 times once per week, or like just how many? How
um,
often do you?
you can come like come like 3 times a week or 2 times a week.
Okay, gotcha. And then like average, like I know like and it's different, but like average, yeah, Bell's parsley. You don't go. How long does it take to fix that?
So, big acupuncture session, huh? You could once we put in the needle, you can
Hmm.
we can also use electrical muscle stim to twitch the needle. When we twitched it, we accelerate our healing process. So
Hmm.
you could just rest for like 15-20 minutes, and then your session will be done. But if we don't use electrical muscle stim to stimulate the needle, no, then
Mhm.
you have to rest with the needles for 30 minutes per session.
So yeah. So you go through the 10 sessions. I mean, that's usually about a 1 week, and then maybe you get better, or how long before you get better?
It's probably best to come like 3 times a week for
Oh,
like 2 weeks, 2.5 weeks, Yeah,
oh
3 weeks.
wow.
Yeah, 3 weeks. 3 times a week 那样. 3 times a week for 3 weeks.
Okay. Yeah, Anthony, no, Anthony know that because the mobile's probably blows hole already. So that maybe you come try it out with her already next
Yeah,
time, Anthony.
yeah. Yeah, come on, Bells. Posey, yeah, 多些 chiropractic services.
Okay, cool. So 22 years like couple, I can do it. Let I just do.
Um, well, people who get into a car accident,
Mm.
that's really high impact on the body, So you're not just hurt in the neck, but you're hurting all over your body because high impact, your whole body gets smashed with the car. So, no, I see a lot of patients who are hurt from car accident.
Uh-huh.
And I see a lot of chronic people, like your elderlies.
Mm.
There are chronic conditions from like farming back in Laos and Thailand, from
Yeah.
heavy lifting, uh, and I do see work injury too. Work injury is like you do repetitive work,
Yeah.
and you have like you have like um
Oh yeah.
strain in your shoulders, and
Yeah.
you have carpal tunnel from
Oh
repetitive.
man.
Yeah.
Okay. Okay, cool. So do you I mean I mean we're about like I know like but your mom we have gout, right? Does that work with gout?
No.
Because I know people ask for that, you
Okay,
know?
let me tell you what gout is. Gout is accumulation of uric acid in
Uh-huh.
your body. So gout is a chemical problem na, 你只要 physical problem na, 你只要 spring strain na, 你要撞杀了呢. So
Oh,
yeah,
okay.
gout has to do with uric acid in your body. It has to do with um chemical accumulating in your body. So
Okay.
so my they try it out because they have gout, and
Uh.
guess what? Oh, it hurts the heck out of them. It doesn't work.
Gotcha. Yeah. I know because it's the foot.
It's
Yeah.
the foot. I,
Yeah.
so, so I just wanna, tell the audience that we take care of physical injury now. Okay,
Uh,
physical injury is sprain strain of your joint in your
yeah.
body. Okay, when it comes to chemical problem like high blood pressure or stroke or gout, those are
Yeah.
chemical problem. 那个
Oh,
so so you have to take medicine to control it, and you have to do exercise so you take less medicine. You have to try to uh really realign and rejuvenate and make your body function
yeah.
better by exercising, because as we get older our metabolism go down and our chemistry change, and so we have to really uh, do exercise to use our body so that our blood don't chana no circulate energy so
Gotcha.
stagnant.
What about like I heard like pregnancy? Can acupuncture help pregnancy?
Yeah, pregnancy. For example, your itu lady会专门有人会去做油呢。Yeah, I
Yeah.
go to a gonna you 下面知道哦。
How does that work? Because is it just really what is it makes the your vital relax and then I guess blood circulation more or I mean how does it work and that kind of stuff?
Um, yeah, we stimulate certain points, and it causes the uterus to open.
Yeah. Wow. Okay. That's why, huh?
Yeah.
Okay. The reason why I say that because like we had problem with having a child. So but itu menggoten for to get pregnant. So every time when we need to uh have a baby, when we need to have a baby, we we go, but we actually pay menggoten so that so it's funny, it works, so that's why I say that, I just don't know why it works, but got that, that's the reason why. So yeah, just like tôi cũng know em muốn go, it's like, man, how come I can't cough? I don't cough for like a whole week. How does that work too? Is it because like you shut something off, or do you know why?
Yes. Yeah. Yeah, yeah, your gonna, so for example, for pregnancy, now,
Mm.
maybe your wife's chemistry is off now, and when we do acupuncture, we balance out the chemistry, and it makes your wife pregnant easier. Hồi có nông lá có là nông gì bên có your point a help you suppress your cough now. It's kind of like taking cough medicine, but using needles on your body.
And is that bad? But yeah, is that bad because got suppressed? No, because the reason got no is to get something out. But yeah, but like got suppressed. No, is that bad for your body? I mean, do you
Well,
know?
no, no suppress coughing actually no stimulate. Got a body go no heal faster not. So no balance out. Got a body your chemistry.
Oh, okay. And just to let you guys know, I don't feel any different. Yeah, could just stop coughing for week. No, so I thought that was kind of weird. So yeah, that's very cool. So the other question was like, we always ask like, do you like chiropractic? Like, do you like, people are like in your crap like your knuckle? Is that bad? Like, you know?
No, it's not bad. No, it's not bad.
Okay. So
Crack it
what's
knuckle. No, no, you can crack it all day. It's
oh
okay.
okay. Okay, gotcha. So all right. So the I guess the real question is like, do you need it? Right? Do you need like do you need it like just to relax your body? Like for example, like chiropractor, like you just need to align yourself. Like, do you really need it as or to you just go to get the service?
Come when you need it. Okay.
Oh, come when you need it. Okay.
Yeah.
It's kind of like massage, right? Massage, you can kind of get it just to feel better all the time. But the chiropractor, like, you don't know, right? But got that. Just come when you need it, right?
Yeah. 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 I think that it's kind of like chiropractic service is kind of like medicine, tenaya,
Yeah.
if you don't have any health issue, why take medicine? If you don't have any string in your neck or back or your
Yeah.
joint, you don't have to come and see us. Because you're
Well,
already flexible. What did you cricket, huh?
yeah.
But whenever you're cricket, then come to see us. Like, you wake up with a cricket neck,
Mm,
or you exercise and you sprain your low back, or
mm,
you're fixing your house up and you fall off the ladder, or
yeah.
you carry heavy cement and you sprain your back. You blow out your low back.
Yeah.
Then it's really ideal to come and see us first before surgeries.
Well, the reason I could know that is because like we used to wrestle in wrestling in high school now. So every week, like that, okay, we need to bring a chiropractor to adjust the teenager. Huh? So I'm like, why is that's weird? Like, like with each like that, you just so you can be loose or something. Go there, okay, I guess, but that kind of stuff, right? So you say if you don't bother it because maybe it might mess you up down the road.
No, 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 you mess her up. but you
No.
won't feel, but you won't feel any difference. You will. You know, because your body is already aligned. You won't feel much difference.
Oh, okay. So you more back problem. Don't go get a chiropractor to crack your back or something. That's what.
No, no, you don't need it.
Okay. Okay. Cool. Cool. All right. So I guess that's very cool. That's the business side. Oh well, just the client side, guys. You guys have any questions or any questions with uh some sort of illness or some sort of aches and pain? Message us, and we'll answer it on the show. As far as like how much it costs, right? You got that you more insurance. Actually, how does it work? You just how much it normally cost? How much do you charge?
So we have a standard fee na yeah, and then
Yeah,
we have like um cash or sliding fee schedule now.
yeah,
So our standard fee for the first visit, yeah, for the first visit we have to do a couple of things. Like we have to examine you, and then we could adjust you, and then we could massage you, and we could acupuncture you. Then standard fee is around 400-500 the first visit up.
uh-huh.
Actually, in my community, I if you don't have a medical card, if you don't have car insurance accident, or if you don't have work comp claim,
Yeah,
then I just do a sliding fee schedule of like 120, still 120 the first visit,
yeah.
and 60 to $80 the second visit. That's my cash fee schedule.
So the 400-500, that's for the whole session, right? But yeah,
Yeah, yeah, ma.
like not the whole session, but like you got there. Yeah, it takes 10 sessions for like I don't know, Hajine, your Bell's parsley. That's $500 just for uh to call hot Bell's parsley, right?
Huh? Yeah,
Oh, that's nothing. I mean, $500 is like I mean, you want your face to be fixed, fast. So that's $500. That's nothing. Yeah, and then the session. Okay, so 120 and the 60. I guess that's manageable. Yeah, cho đã lẻ. I'll pay 120 because like there it hurt like crazy. Like that you just have to weigh it out for 1 week. No? So I see what you're saying.
yeah.
So
So in my clinic, I'm a provider for most major health medical corner.
uh,
So, I would ask if you have any medical cards that I can use, or if you get into a car accident, then you use your claim number for care. If you get into work injury, then you use work comp claim number for care.
mm,
If you don't have any of those, then I put you on the cash fee schedule, which is 120 or 60 to 80 after the first visit. Yeah, and yeah, so there's many ways of paying our office now. So it's not just using a medical card. So there's many method of payment.
yeah, and each session is like how long does it take?
Um, the first visit is like about 1 hour, no, and
Okay.
the second and subsequent visit is 30 to 40 minutes.
Oh wow. Okay. Man, it's almost like you're almost as you're you're almost cheaper than a regular massage. Yeah,
Yeah,
because the massage, they charge like almost $80 to massage, and it got to your doctor, got to the come on, you're charging pretty cheap. I don't know.
yeah,
Wow.
I reduced it a lot for to be affordable for those who don't have medical cards, or
Yeah.
they don't have car accident or work injury. Nah.
Wow. That's very. Yeah. That's very. I mean, nice of you to do that. I mean, that's just. I mean, most people don't know. Like, I did not trust acupuncture. Go there. Hey, that's just len but like I finally realized, it took good and I'm like, oh my, well, that works. Yeah, we didn't have successful babies. It didn't go, and I'm like, wow, that does work. Now we have a baby too. So so all that works for us, and we believe it. So that's why I treat you guys with respect, that's no, no. So that's just me personally. Um, so yeah, so is this? I mean, I'm assuming this business profitable because you've been doing this 22 years. But yeah, so you get
Yeah,
mostly repeat customer that right?
yeah,
Wow.
repeat
Okay.
customer. Yeah.
Cool. So, this is it. I mean, you guys have any questions? Go ahead and message us. So how do people get a hold of you? Like, got that call Lou off in Jean Crystal. Is it Crystal Lake or what? I don't know which both channel.
No, no, it was Crystal. So I
Oh,
Crystal.
Crystal.
Yeah.
Okay. So what is it called?
Oh, so I just named it after my last name. So,
Ah,
so I just named it Moua-Lor Chiropractic and Acupuncture because 그런 거 뭐예요? 그거 지목하래요.
yeah.
So I just put those two last names together so that auto sing just
Yeah.
support 구나.
Yeah. Very cool. So I think your office is it open already, or is it like you still grand opening yet, or what is it?
Oh, yeah, I relocated my clinic from Minneapolis to Crystal, and I opened right away because I fixed up my new clinic already.
Uh-huh.
So I moved it to Crystal, Minnesota, which is like only 10 minutes away from each other. So it's
Oh,
Crystal is
okay.
next to Minneapolis. I just moved like 5 miles away from my old clinic so that
Uh-huh.
all my patients can still
Oh,
enjoy coming to my new location. Yeah. Yeah, so it's I never had a gap. I never had a gap in I never closed my clinic down during the transition.
okay, good. Do you have a website or a phone number?
Yeah, I do. 구두서 똥도 하루요. 612-529-0202. And I do have a website too. It's called hmongchiropracticmn.com. And 여기도 그런데나 it will pop up on Google. 그런데요, Yer Moua-Lor요.
Uh,
Yer 그리고 생겨요 MOUA-LOR.
that's it. So you guys looking to like cure some neck pains or Bell's parsley or get pregnant, reach out to Dr. Yer here, So, yeah, thank you for coming on the show and talking about your business. So usually, like we usually ask big guests, like one last question is, can you tell us one thing you learned about money since you've been doing this for 22 years? That's really, most businesses they don't, you know, they usually die within like 5 years, but you kept it going for 20 years. So that's really, a successful business. So can you tell us something that you learned about money?
Um, yeah, well, yeah, the reason I've been successful is because my community have come to use me from day one.
Mm.
Uh, bé nhau hậu Twin City nó về bé mua cái chống về yêu khi yêu là lo chỉ yêu clinic chỉ yêu real estate chỉ yêu grocery store này yêu Kusana thế yêu thọ lại都thấy yêu nè thì
Yeah.
bây giờ mong yêu cho số số thấy yêu nè so more I have a niche, and I became successful right away compared to my fellow American colleagues now, because
Yeah.
with your American colleague, they're the mainstream doctors, and it's even more competitive for them because they don't have a niche.
Oh, yeah.
They don't have a community to support them right away. So I've been successful because my Hmong community have come to support me since day one to this day.
Yeah.
Yeah, hay cho money I think that so you are you you have to do another side business now. So yeah, if you're the chiropractor, come on clinic. This is good.
Yeah.
不开晒 business，要 real estate 挺好啊。
Wow, you do real estate? Oh, okay, cool. Yeah. We need to talk about that later.
I do a little bit of real estate, and it helps a lot. It helps boost my finances a lot, you know.
Uh-huh.
So you order the company, they well, they are doctor, they are lawyer, lo. You
Right.
gotta do a little bit other business to get you extra money, nah, to
Yeah.
invest.
Uh-huh.
And I learned that I've used a financial advisor for 20 years, and they don't cost a lot. They don't cost hardly anything. Oh, financial advisor are very, very affordable. I think
Yeah.
it's more affordable than a real estate agent. Oh.
Uh-oh. Let's not start a fight here.
No, because no, I feel like
Yeah.
I hardly pay them anything, but they have helped me set up my portfolio now.
Yeah.
And they educate me, and I can say that I tried investing for the last 22 years,
Yeah.
and I think that because I follow the instruction of a financial advisor now,
Uh-huh.
it helps me a lot. Like I think that the rate of return has double my principal. So
Mhm.
that's what I learned about money.
Well, I think the reason why you say that is because they're making you money, right? That's why you like it more. That's why. That's awesome.
Definitely,
Uh,
definitely. You give
yeah.
them, your principal. You give them a little chunk, and they could double it for you.
Yeah. Well, especially in real estate. So that's one thing I love about real estate. So that's awesome. Any last words before we let you go?
Well, I want to thank you, Chai, for bringing me on your Hustler live show. Um, I learned a lot from other guests too, so I want to thank everybody for their time. And if you guys, anyone have questions, feel free to reach out to me. Again, my phone number is 612-529-0202. And of course, I'm on Facebook, and I'm on website, so
Hmm.
feel free to call me with your healthcare questions.
Yeah, and I'll take all that and I'll put it in the show notes, guys. So you guys can follow her. But yeah, reach out to her if you guys have any issues and more questions. So until then, guys, have a good night and keep hustling. And hope you guys, you guys want to learn about real estate investing. I do have a conference coming up in August 25th, 26th. Let me put it up at the end of the show. And until then, guys, hope to see you guys there. Okay, so good night, everybody.